or hip fracture on your left side. Okay, do I have your permission to do that?
Yep.
Okay, so my tech here has a walker, and we're going to show you how to use this to get out of your wheelchair. So first, we're going to unfold it, and these two little knobs here will unclick it.
You have to push them in and then slide the arms out.
Okay, and you want it to be straight. Okay, most walkers have a nice little button. Okay, and then this one should click open. Perfect. Okay, so in your wheelchair, we're going to put the walker right here. I want you to scoot to the edge, not yet. Then you're going to put your hands up on the armrest. After we hit the brakes, that's a huge safety concern. And then you're going to push up and grab the walker with one hand and grab with the other, and then stand up completely straight. And then the way we're going to walk is you're going to go walker, left foot, right foot. Walker, left foot, right foot.
And that's called a modified three-point gait. And so what we're doing is we're using the walker first and then following with the effective leg so the patient can put her weight through her arms and then follow with the unaffected leg. And we're choosing a walker for this patient because she is elderly, has osteoporosis, and congestive heart failure. And so the walker is more stable as opposed to crutches or a cane, and she can use it more long term. She'll be able to put more weight through her arms as opposed to using another assistive device.
And then also when we stand her up, we're going to fit her to this. But so to sit down, you're going to back up to the chair until you feel it on the back of your knees. And then you're going to reach back for one armrest and then reach back to the other and slowly lower yourself down. Okay? So we're going to practice that with you now. Sara is going to be my aide in this. But first we're going to stand you up and make sure this fits.
And we are making sure her lovely wheelchair is locked, and I'm going to go ahead and support it back here. And then if Katie asks for my help, I'll help with assisting her standing up with her gait belt.
Which we already applied the gait belt. This is something that you're always going to do with your patients for safety. So if you can go ahead and scoot up to the end of your chair. Okay, and so I am going to do this and holding onto your wheelchair. Sara, will you also hold on to the back? Go ahead and stand up and then one hand and then the other. Okay. And how are we doing balance-wise?
Good.
Okay, and so we're going to make sure this fits her.
And the way we want it to fit, this looks pretty good for Pat right now. We want the elbows to be slightly bent at about 20 to 30 degrees of flexion. And we want the handles to be about the level of the greater trochanter or at her wrist crease. So this looks pretty good.
Okay, so we're going to teach her this modified three-point gait. So go ahead and do walker, left foot, right foot. Doing great. And the whole time you're holding onto this gait belt, making sure she's stable. And then to turn, we're going to kind of take some wide turns because we don't want the person to just pivot in their wheelchair. So. And this hand would be on the front of their shoulder just to make sure she doesn't fall forward. Now that she feels the chair on the back, she's going to reach down with one hand and then reach down with the other and slowly prop herself down. And then she's golden.
Yep, we asked her if she has any questions.